Why not direct taxpayers be given health insurance from the government?
It's a good question, Dinesh. Rich countries have the practice of health insurance, but even they do not all have health insurance. America is a country which is based almost entirely on insurance. See the experience there. In America, for the elderly people, they have what is called Medicare system. You pay from your wages in public sector or private sector, and employer pays a part until you retire at the age of 65 or something. Above 65, there is free care. So even in America, insurance is not working for the large proportion of population above 65. Remember that. And most healthcare needs are where? Aged population. And similarly, for the indigent poor and certain other categories, there is something called Medicaid. Again, that part is not covered by insurance. The rest of it is covered by insurance. Every citizen buys insurance. I already told you how much money is being spent. The total money spent by the government or by the citizens is about 18%, 19% of GDP. But America is 35th in the healthcare outcomes. So insurance gives you an illusion in healthcare of the cost being met because I paid the premium. When there's a catastrophic expenditure, a sudden unexpected expenditure, instead of my family becoming bankrupt, the insurance, actually I am bearing it, nobody else is bearing. Except that collectively there is risk pooling. So there is a satisfaction that in times of crisis my needs are met. But what is the downside of that? Number one, it will not work unless I am a regular worker with a monthly wage. That means organized sector employment. The countries with insurance have 90 to 95% people in the organized sector employment. So if you are working in an organization, you pay X amount like Provident Fund towards health insurance, and the employer may pay as per the job contract. In India, 92% of the workers are in the unorganized sector. There is no regular job. There is no monthly wage. There is not even a regular wage. One day you may get some work, you get some payment, next day you may get nothing. So you don't even have a mechanism to collect insurance even if you want. Two, insurance by definition means high-end care is private sector driven. Now healthcare costs skyrocket enormously. To build a decent tertiary care hospital costs about 1 crore to 2 crores per bed. You are an orthopedic surgeon. You know how costly it is, trauma care or something else. Or internal medicine, critical care or pulmonary care or something else. No, it's not the doctor's fault. Modern medicine also means modern technology. Modern technology is improving every day. New interventions are coming every day. They are very sophisticated. An MRI costs about $1 million. That is 7-8 crores in Indian rupees. A CT scan, depending on the kind of CT scan apparatus you want, costs about 2-3 crores. A PET scan costs maybe 10-15 crores. If you want stereotactic radiotherapy, it costs about 20-30 crores. Each is like a big factory. All this in one hospital in a poor country. So you can't blame the hospital or anybody. The costs skyrocket. Therefore, the cost of care cannot be brought down because your insurance does not take care of the primary care needs. It takes care of the hospital's catastrophic expenditure. So what is happening? You are driving a primary care problem into a catastrophic problem. Instead of dealing with the person early on, identifying it and managing the patient with hypertension, let us say high blood pressure or diabetes, blood sugar or some other problem, instead of dealing with them early on and properly managing the patient, you allow a crisis to develop, then have dramatic interventions which are very high cost with low impact. That is the logic of insurance, the way it works. And the third problem with insurance is, it's very well known, the markets do not work in healthcare beyond a point because there is asymmetry of information. The patient does not know enough, is always very worried. If the healthcare provider or the insurance company knows much more than the patient. Therefore, an honest bargain does not work. Sometimes a clever patient may overuse the facilities because anyway I am insured, therefore even if I don't need it, I will try to use my judgment and push the system to go for high cost after I am not spending money. In America it's very common. Pharma companies, we all know, drugs keep on getting improved. A drug is available, it's open source, anybody can now manufacture in the world. It's no longer covered by intellectual property. Therefore, the price can be controlled because of competition. What do the pharma companies do? They modify it a little bit. There is no improvement in the efficacy. They put the cost 10 times or 20 times more because now there's intellectual property, the patent rights, and they market enormously, telling the people this is a fantastic drug. Now, a patient with insurance cover, when I don't pay out of pocket, supposing the doctor gives me a choice of a drug that is costing 1,000 rupees, the same thing costing 10 rupees. The doctor knows both are the same, but the 1,000 rupees is allegedly a new drug. They're advertising heavily, and I don't pay anything extra. What would I choose?
Obviously higher.
Because there is a mistaken belief that the higher the cost, the better it is. For people to understand, recently, for instance, for COVID, Molnupiravir has come. Now, the drug companies in the US, they priced it at $700 a tablet. $700, it takes 10 tablets, a course of 2 tablets a day, 5 days. $7,000 for a course for one patient. Our companies could bring down the price to 125 to 130 rupees a tablet. What is 50,000 rupees there? 7,000, no, not 50,000. 5 lakh rupees there. 5 lakh rupees there. We can do it at 1,000 rupees here. Or 1,500 rupees. Now, that 5 lakh rupee fellow comes up with a minor change without any improvement in the efficacy and prices it high. So this is very common. These are not mythical problems, these are real problems. World over we are seeing. So adverse selection is one other thing. What happens? When I feel I need health care, I'll have problems, then I buy insurance. If I feel I'm healthy, I don't buy insurance. So what is happening? The cost of care for those who are insured is becoming very high. Insurance works on the basis of risk pooling. If 100 people pay insurance, only 1 or 2 get serious disease, therefore the 100 premiums can be spent on 1 or 2 people. If only the 10 people likely to get the disease by insurance, the 90 who don't have the problem, they won't buy insurance, then it will not work. It will collapse. So what will happen? Premiums go up. Because more premiums are there, healthy people even further get out. Earlier, some of the healthy people may have also gone into it. Now the premiums are so high, the risk is so low, I don't want to be a part of it. I'll come out of it. So adverse selection. So insurance in our conditions will not work. It can work judiciously. For instance, your secondary care, your Arogyasri in Andhra Pradesh, Telangana, or your Prime Minister's Ayushman Bharat, these are insurance-based systems. It's all started from Andhra Pradesh. For secondary care, judiciously used with certain modifications. For instance, you must take away tertiary care interventions, very high-cost interventions from there. 50% of all the expenditure on Arogyasri in Andhra Pradesh, for instance, is on 4 interventions. One of them is orthopedics and trauma care. One is heart surgery.
Cardiology.
Another is cancer. The 4th is kidney problems. These 4 take care of 50% of the total cost. If you relegate most of them to tertiary care, but cover every secondary care intervention for all the population in a judicious way, because already we have a robust platform. A secondary care insurance model, Arogyasri model is there. If that is modified for that limited chunk, insurance will work well. But if you include tertiary care, in a country with abject poverty and high cost care at the tertiary level, it simply collapses. So insurance is not a viable model for the bulk of the people, for the propertied people with a good regular monthly income, knowledgeable people, already they are buying insurance, and that will continue to grow. And the private sector tertiary hospitals primarily will cater to those needs. Because whatever you do, about 30% of Indian population will depend on private sector. They will pay. They will be happy to pay. For them, insurance will work. For the rest of the people, insurance is not a viable option.
Hi, this is Taman.
Hi, this is Shraddha Das.
Hi, I'm Priyadarshi. Nenu mi Adi.
Hi, I'm Kashish Vora.
Hi, నేను శ్రీ విష్ణు.
Hi, this is Aditya.
Hi, this is Naganvesh.
Please subscribe to Social Post.
Please subscribe to Social Post.
Please subscribe Social Post.
Please subscribe to Social Post.